My name's Angie Hornbrook. I'm a ski instructor and examiner with Professional Ski Instructors of America. I've been teaching skiing for 31 years. I have been seeing Dr. Stone about knee problems for a while, and I had a medial MAKO with great results. I was back doing almost everything after 8 weeks and absolutely everything after 12 weeks. I realized shortly afterwards that my lateral side of my knee was weak and just not holding up to the rest of my strong new knee. And I asked Dr. Stone if he would put another unicompartmental piece into the other side of my knee. They did that, and essentially now I have had a brand new state-of-the-art, basically a knee replacement without cutting out any bone, any tissue, and with an amazingly quick recovery. So there are a lot of doctors out there that say, don't ski, don't do this, don't do that. That should not be your doctor. I was very happy to find out that there are very few people out there, but there are some that have a double MAKO in one knee. And I truly believe that this is the replacement of the future. I have basically the same amount of flexion and extension and strength as my other knee, as my healthy knee. It's better actually than my other knee as far as pain goes. I skied 100 days this year, lots of powder, and my knee was never swollen, never sore, very strong. I never thought, honestly, after so many years of swelling and arthritis and pain and dealing with it in so many different ways, I really never thought that my left knee would be absolutely pain-free, but it is. Whatever you do, don't get a partial knee replacement until you look into this MAKOplasty. And whatever you do, don't get a full knee replacement until you see these guys that are capable of lining up your knee better than it was before, putting small pieces of hardware in there, maintaining your entire natural knee basically with a patch. Absolutely no issues with the knee whatsoever. I'm riding my horse all summer, and I couldn't be happier and more grateful for this procedure and for Dr. Stone.